So now we're going to talk about VOR impairments to treatments. So in the evaluation in their DVA test, this person had a 3-line loss between static and dynamic visual acuity with dizziness and mild nausea. They rated their symptoms with the test as a 5 out of 10. So let's think about treatment. So we'll start them in sitting with an eye chart 4 feet away at eye level. We have a piece of paper that has a black pineapple on it. So we often are talking about look at the pineapple. We are going to instruct the patient to move their head in small ranges, but 20 degrees side to side, as if saying no, 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 while looking at the pineapple for 30 seconds. We're going to set the metronome at 105 beats per minute, turning their head to each beat. And we're choosing that because this person reports dizziness with head movements, and the average head movement, quick head movement, is a little more than 100 degrees per second. So using Dr. Bareen's chart to customize 100 degrees per second, we're going to start the metronome at 105 beats per minute because they're moving their head 20 degrees side to side. And I encourage you to see the video on that for more information. And then we're going to rest 5 to 10 seconds. If we have to wait longer, that's okay. But if it takes like 5 minutes for someone's symptoms to come down, we think that's too long. So we expect their symptoms to start to come down. Let's say they're at a 5 out of 10. They go up to a 7, 8 out of 10. We expect that to come down within seconds, couple minutes, but no more than 5 minutes. And then they'll repeat that with small up and down head movements, as if saying yes, 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 still staying in that 20-degree range. And they're turning the head to each beat of the metronome. So we'd have them do, again, 4 sets of each. If they could do that 3 times a day, that'd be great. If our patients have anxiety with moving their head, we start them at once a day. And maybe do that for 2 to 3 days and then start to increase it to 2 times a day, 3 times a day. So how would we progress that? Progression would be to increase the duration to 60 seconds without stopping. We'd also want to think about increasing the metronome speed to 125 beats per minute. So we usually continue to increase the metronome by 10 beats a minute with a goal to reach 150 beats. And that has to do, again, with the average peak head velocity during head movements, so kind of higher demands during activities of daily living. But what if they're not improving? Like, we would expect improvements in this within days, certainly within 7 to 10 days, but what if they're not improving? What we like to do is ask the patient to start performing this with a towel roll. We also do this if their technique is poor, they don't have good quality neck movement. Again, we may be integrating other activities like cervical proprioception with a joint position error test. Or they have poor technique, their head movements are just too big. We like to have them put a towel roll or a scarf around their neck, hold it in front of them. Not only does it support their neck, but it gives them feedback about how big the head movements should be. So other patients have a lot of visual motion sensitivity, and so we may have them do VOR in the dark. So we have them dim the lights, find a light in the room, or they can set a laser if they have a laser pen on a table. If they hold it and move their head, it's probably going to make it shake too much, so they can set it down. But where they have a lot of high contrast, because that's what the research that suggests is important, is high contrast. Or you can decrease the duration. You don't have to do 30 seconds. Remember, based on the literature, with these shorter durations like this, these shorter frequencies of head movement, anything below 156 beats a minute, is not going to promote true VOR adaptation, but we are using habituation, which is quite successful to help decrease their symptoms. So what are some other progressions? We can go seated to standing, standing feet together, partial tandem to full tandem, standing on a firm surface to standing on a foam. So there's a lot of ways to progress the VOR. We often talk about the surface. Based on the more current research, what it appears is using, high contrast, increasing the duration is the most critical, as well as reaching some minimal speeds, like 156 beats per minute, is the minimum speed needed for true VOR adaptation. So these are just a few examples of ways to progress VOR exercises.